Hi, Joanne Quinn, co-founder of REMEDIGAP.com, here to make Medicare and Medigap a little bit easier, one video at a time. And if you travel for leisure, travel to visit family, or live in another state part-time, you might be wondering how Medicare Supplement insurance works while you travel outside your zip code, your city, your state, or even the United States. And if you've done any research about Medicare, you might already know that Medicare's network is huge. In fact, there are 515,000 providers actively receiving Medicare payments according to CMS, the Centers for Medicare and Medicaid Services, as of January 2017. So this is a huge benefit to you while you are traveling. But do you wonder if a Medicare provider will accept your Medicare Supplement insurance plan outside of your zip code? Well, I'm going to provide you all the details about how Medicare Supplement insurance works while you are traveling, how it compares to Medicare Advantage plans, and make sure you stay to the end for my tips on how to use your Part D drug coverage while traveling as well. So let's get started. You know, the great news about Medicare Supplement insurance is that you can use it across all 50 states, including U.S. territories such as Puerto Rico, District of Columbia, U.S. Virgin Islands, Guam, American Samoa, and Northern Mariana Islands. So all you have to do is remember that a provider who accepts Medicare will also accept your Medicare insurance plan regardless of who the insurance company is. For example, let's say that you live in Texas and you purchased a Medicare Supplement plan from Manhattan Life Insurance Company, and you are going to travel to Florida either for pleasure or maybe you live there part-time, but you realize that in Florida, Manhattan Life does not sell Medicare Supplement insurance. So you're wondering, will your plan work in Florida? Well, not to worry, you can absolutely use your plan. Again, while traveling, it's not about the name of your insurance carrier. It's about seeing providers who accept Medicare, and that's the key. As long as you go to a provider who accepts Medicare, wherever you are in the U.S. or the territories, then your Medigap plan will pay its portion of cost according to your outline of benefits for your plan. And it works seamlessly because the provider sends your claim to Medicare, who then processes it and then electronically sends it to your Medigap insurance company, who will then, pay its portion of costs. So the bottom line is, as long as you are seeing a Medicare approved provider who is in Medicare's vast network, then you will be covered, and your Medigap insurance plan will also work regardless of where you are in the United States. So now you know how Medicare Supplement insurance works within the United States and its U.S. territories, but what about foreign travel? Well, Medicare itself is very limited on what it will cover outside of the United States. In fact, there are only 3 situations in which Medicare will provide some healthcare coverage, and they are very limited and have very strict rules that apply with hospital stays within Mexico and Canada. So I advise you to read the publication in which CMS put out regarding those rules, and I'll put a link in this post below so you can look at the details of those situations. But now let's focus on Medicare Supplement insurance plans and how they work outside of the United States. So Medigap plans C, D, E, F, G, H, I, J, M, and N pay 80% of the bill charges for certain medically necessary emergency care needs outside the U.S. after you have met a $250 deductible for the year. Now, keep in mind, these Medigap policies cover foreign travel emergency care if it begins during the first 60 days of your trip and has a lifetime limit of $50,000. Now, I want to be clear, Medicare Supplement insurance is the same thing as Medigap insurance. The terms are just used interchangeably, but they are the exact same types of health coverage. But what's not the same are Medicare Supplement plans and Medicare Advantage plans, and they definitely don't work the same while traveling. And one of the reasons why is because Medicare Advantage plans do not use Medicare's huge network of Medicare providers. Instead, Medicare Advantage plans, being HMOs and PPOs, have providers in their network, their service network, dedicated to your zip code or your county. So this limits your availability when needing a provider out of your area. So depending on the type of coverage you have with a Medicare Advantage plan, it's quite possible it will not cover you as you're traveling throughout the United States and the U.S. territories. It really all depends on where you're traveling, how long you're traveling for, the type of care that you will need. Those are really important details if you are planning on getting a Medicare Advantage plan or you have one, that you really take a look at the rules that apply to traveling within the United States with that Medicare Advantage plan. And the same holds true if you plan on traveling with a Medicare Advantage plan outside of the United States. There are different rules that apply with each Medicare Advantage plan, so you want to make sure that you look at those rules for your particular plan, which is definitely not the case with the Medicare Supplement plan, also known as a Medigap plan. You do not have to continue worrying about what rules apply. You never have to check that. If you have Medicare and your Medigap plan, then you know that you can visit any doctor within the United States who accepts Medicare and you will be covered. And let me share an example of how Medicare's network really came in handy for my father-in-law who was getting ready to travel out of the country. Prior to leaving, he was staying with us, and the day he was actually leaving, noticed a spot on his skin that was rather uncomfortable. So he wasn't near his home, so he wasn't able to see his dermatologist, so he had to find one near our home, which he was able to do using Medicare's network. Their provider network. Now, had he had a Medicare Advantage plan, it would have been a different story. He would have had to go outside of the network, which would have incurred either the full cost of the provider visit, or he would have had to pay a higher out-of-network cost. But because he had Medicare and a Medigap plan, he had no problem finding a Medicare provider, having that spot taken care of before he left for his vacation, which he was going out of the country, so Medicare would not have deemed that as medically necessary or an emergency while he was traveling out of the U.S., so he would not have been able to have that treated until he returned. So it was good he was able to take care of it before leaving. And as promised, let's talk about Part D drug plans and how they work while traveling. Now, if you already have a Medicare Part D plan or you're going to be choosing one, definitely want to check on this. When you are in Medicare's Plan Finder tool, or you can even call Medicare directly, but what you want to know is that this particular plan has national coverage. In Medicare's Plan Finder tool, you can do this by looking at the plan and finding the little N. That N indicates national coverage, and you can use this plan across the United States. The other thing you want to do is make sure that you choose a plan that maybe has more than one retail location. So right now in 2017, at the time of this video, there's a plan called AARP Walgreens. This particular plan you can only use at Walgreens. So if that's a plan that you're going to choose where you can only have one retail location, you might want to make sure that that retail location is available wherever you will be traveling, and especially if you live somewhere part-time. Of course, there's so much more to learn about Medicare and Medicare Supplement insurance. And if you're just starting your research, feel free to access my free Medicare e-course by simply clicking on the little I in the right-hand corner of the screen, or by clicking on the links in the post below. I cover all the different parts of Medicare, enrollment opportunities, deadlines, penalties, and so much more. And if you want to stay on top of Medicare topics, feel free to join me at REMEDIGAP's Facebook page. And of course, you can subscribe here so you can always see my videos when they come out. And if you like this video, please like it. And last but not least, share it with your friends so that they can stay informed as well. I'll see you next time. Thanks for watching. While traveling, it's not about, what is it not about? The name is right there. Let's touch on, travel, healthcare need. No. All right. So easy. Okay.